Hello, in this video, I'm going to tell you about the difference between plantar fasciitis and plantar fasciosis, and then I'll talk a little bit about treatment for both. Okay, so plantar fasciitis is pretty well known. It's inflammation of the plantar fascia, which includes redness, pain, heat, and swelling. Plantar fasciosis is a term that most people have not heard of before, but interestingly, most cases that are diagnosed as plantar fasciitis are actually more likely to be plantar fasciosis. So, any condition ending in osis refers to degeneration of that tissue, compared to anything ending in itis refers to inflammation. So, the plantar fascia on the bottom of the foot actually doesn't tend to become inflamed because it doesn't have an adequate blood supply to cause much inflammation. So, it can become inflamed under certain circumstances, but that's far less common because the plantar fascia does not have a very extensive blood supply. So, just as a general rule throughout the body, tissues that have more blood supply have more capacity for inflammation because the chemical process that causes inflammation is carried through blood flow. And then inflammation itself is more blood flow. So, areas of low blood flow tend to not become inflamed very often. Instead, in plantar fasciosis, that's degeneration of the plantar fascia. What happens in tissues like fascia or like in a tendon is another example. When we are overusing that tissue, we're breaking down the collagen, the strong protein that makes up that tissue, which is normal. We go through that all the time. We do normal remodeling of our tissues where we break down the old tissue and we replace it with new tissue. But the problem is if we are breaking it down too fast because maybe we're doing something incorrectly, or we're engaging in an activity that's causing too much breaking down, or we're overusing a structure, then sometimes we break it down faster than we can replace it with the correct type of collagen. Now, there are actually several different types of collagen that we have different functions in the body. We use them in all different places in the body to do different things. Our fascia and our tendons and ligaments are primarily made of type 1 collagen, which is the densest, toughest, strongest type of collagen. So it also means it takes the longest to make. So when we're breaking down the correct type of collagen, the type 1 collagen, faster than we can replace it with more type 1 collagen, then what we do is instead we'll put in other types of collagen that we can make faster so we can replace it faster, but it's also not the right type of collagen. So it's weaker and it's going to be more prone to rupture and to further injury down the road. So this can happen over a period of time, and over time, that structure is gradually being converted from a type 1 collagen structure into something made of just the wrong type of collagen. And that's when we're most likely to have some kind of rupture or serious injury to whatever that structure is. So plantar fasciosis is a lot more common than plantar fasciitis, and it's a completely different process that's taking place in that structure. Both conditions are going to really put that tissue at risk of further injury. Now, thankfully, the treatment is basically the same regardless of which condition you have. So even if you were told that you have plantar fasciitis, but maybe you suspect it's actually fasciosis, it's okay because you're going to treat it in the same way either way. So it's helpful to understand the difference between the conditions, but it's not practically going to make a very big difference. So there are some things that you can do to help if you're having pain on the bottom of your foot. So some people respond well to pain relievers or anti-inflammatories, just over-the-counter medications. Depending on the severity, you might require physical therapy where they'll help you with strengthening, stretching, and they might apply other modalities. You might be given night splints to maintain your ankle in a neutral position or even slightly dorsiflexed, meaning like if you're laying on your back, your toes coming up towards your head a little bit. So one of the things that commonly leads to plantar fasciitis or plantar fasciosis is if we have too much tension from the calf pulling on the Achilles tendon. So if we go back to our previous slide here, let's see if it'll let me go back. There we go. You see here's the Achilles tendon, and it actually it swoops down to the bottom part of the heel where your plantar fascia starts. So when we have a lot of tension pulling up on the Achilles tendon, it puts a lot of tension on the plantar fascia on the bottom of the foot. So if you are overworking your calves and you're not stretching them enough or working on your mobility, or if you have your toes pointed a lot, like during sleep, then that can absolutely lead to any condition of the plantar fascia. So a lot of people who have a plantar condition, one complaint is that when they get out of bed in the morning and they put their feet on the floor, that it hurts so bad. And then sometimes it feels a little better as they get moving for the day. That is a sign that that person is pointing their toes while they're sleeping. Something I have found is a lot of people who have plantar fascia problems are stomach sleepers. So what happens is if you're sleeping on your stomach, you point your toes while you're laying on your stomach. So if you have plantar fascia problems, you have pain on the bottom of your feet, and you're a stomach sleeper, that means either start learning how to not sleep on your stomach, or you can just scooch down lower on the bed so that your toes can hang over the end of the bed so that your feet can be in a more neutral or dorsiflex position instead of having them pointed all night. Because when you're pointing your toes for extended periods of time, whether that be at night or in some activity that you're doing during the day, you're increasing the tension on your Achilles tendon, which is increasing the tension on your plantar fascia. So that's where a night splint can come in handy if you have a hard time kind of changing those habits, because it's hard when you're sleeping. We revert back to habits that we have in place because we're sleeping. You can't consciously overcome that if you're not awake. So night splints can be really helpful with that, or just work on not sleeping on your stomach if that is the problem. Then also sometimes orthotics can be helpful. So like inserts that you put into your shoes that help you redistribute your weight better. You can get custom orthotics that they can make for you after doing a scan or a mold. The orthotics that they sell like in the drugstore, it might be better than what you have now, but it's maybe not going to be adequate necessarily to help with your plantar fascia. So it could be something to try. But if you really want to give it a good try with orthotics, you need to go get custom orthotics that are made for your particular feet. Depending on the severity, you might also require a walking boot, cane, or crutches for a while to prevent full weight bearing so that you can allow that tissue to heal. So that won't be a temporary, or that won't be a permanent solution. That would just be something you do temporarily while you allow the tissue to heal if it's severe enough to require that. Then if you're not responding to any of these things, sometimes they will resort to steroid injections. I am personally not a big fan because it does weaken the other tissues. It weakens your bone tissue and other things. So if you're having steroid injections repeatedly, that can cause more problems down the road. So it's best to avoid those when you can. If any of these other things help you, then great. And if these things aren't helping, then sometimes you just have to do what you have to do to solve the problem. And that could mean steroid injections. But always follow the advice of your doctor, always over what I say, because I don't know you. So go see your doctor and follow their advice. All right. Thank you so much for watching this video, and I hope you have a great day.